But the good news is that about 90% of the affected women conceive after medication. After this procedure, the ovulation rate is enhanced to about 70%. About 10,000 steps per day or 30 minutes of brisk walking should be your basic physical activity. In my OPD, women come complaining of inability to conceive after around 6 months of marriage. But that's not infertility as such. So what is infertility? It is defined as 1 year of unprotected intercourse that does not lead to conception. For those who are more than 35 years of age, it is 6 months of unprotected intercourse that does not lead to conception. Women with PCOS who complain of inability to conceive usually respond very well to infertility treatment, and it is a myth that you cannot conceive with PCOS. The treatment options include medication, surgery, and IVF. Today we are going to discuss in detail about these options, but do remember that diet modification and exercise are still the first line in combating infertility due to PCOS. If your BMI is more than 30, then about 2 to 5% reduction in your weight by regular exercise and diet modification can regularize your cycles and improve fertility. For this, you must include a diet that is rich in antioxidants, multivitamins, iron, etc., and that is low in saturated fatty acids. So, your diet should contain lots and lots of green leafy vegetables and fresh fruits. So, it is better for you to adopt a diet that is high in proteins and low in calories, the details of which I have already explained in a previous video, the link for which you can find in the description. Do visit your gynecologist who will prescribe to you folic acid for a few months if you're planning pregnancy. Please avoid red meat, alcohol, smoking, processed foods, and refined sugar. Leading an active lifestyle not only improves your mood but also stabilizes your hormone levels and is good for your ovaries. It regularizes your periods and improves fertility. About 10,000 steps per day or 30 minutes of brisk walking should be your basic physical activity. Even a 10-minute walk done regularly has been shown to kill cravings for chocolate and control binge eating. So this prevents weight gain. So on an average, you can do a 30-minute workout daily, such as yoga, aerobic exercises, or resistance training, or simply dancing, swimming, running, etc., which should involve your large muscles. I have spoken at length about the exercises which you can do in PCOS in another video. There are multiple medication options if you're planning to conceive. We usually start with oral ovulation induction drugs. These drugs act on the ovary and help in the release of eggs. For example, clomiphene citrate and letrozole. Sometimes, injectable options such as gonadotropins may be required, and the follow-up of ovulation is done by routine ultrasound. About 40% of the women who have PCOS find it difficult to conceive. But the good news is that about 90% of the affected women conceive after medication. Oral medications are about 70 to 80% effective in stimulating ovulation. In people who do not respond well to oral medication, another option is surgery. Laproscopic ovarian drilling is a procedure in which small holes are drilled in the bulky ovaries of PCOS that will make them more responsive to hormones later on. After this procedure, the ovulation rate is enhanced to about 70%. IVF stands for in vitro fertilization. It means The egg and the sperm, which is taken from you or a donor, are fertilized in a test tube and then implanted into your uterus. This requires many medications simultaneously also. IVF is a very effective option for those who have failed to conceive despite 6 cycles of ovulation induction or surgery, or they have other standing issues. Before going for the treatment of infertility, there are many investigations that need to be done. For example, semen analysis, uterine factors testing, tubal factors testing, etc. Also, your thyroid and prolactin levels need to be checked. The treatment of infertility is often a time-taking process and needs regular follow-up. It is important to lead a healthy lifestyle and very important to not lose hope. I will be discussing about infertility in my upcoming videos.